My name's Steve Pollard. I am the Head of Information and Business Intelligence at Birmingham Community Healthcare. My presentation today is called Information in a Crisis. The crisis obviously in question is the pandemic that was mentioned earlier. I'm going to start by asking a very simple question, which is what happens when we go information crazy in a crisis? I've underlined the word crisis because it's a relative term for a time-sensitive and difficult situation. It doesn't need to be on the scale of a pandemic. It could be as simple as running late for the school run, asking the kids, are you dressed? What time is it? Have you eaten breakfast, etc. Something which I experience quite a lot. And the next slide is my attempt to kind of demonstrate this in a process flow. So from my experience in a crisis, somebody provides a lot of information. Demand increases, delivery time typically decreases, which normally results in poor data quality, it's untimely, inaccessible. Decentralized is probably much more relevant now because we are a decentralized workforce. I've been working at home since the crisis began, and lots of other people have been redeployed. So what happens to our decision maker? Well, they're obviously involved in lots of meetings, and as this cycle continues, they get gradually more unhappy because the information isn't good. And that's not something they can resolve by themselves. So what normally happens is the cycle starts again. They need more information, and sometimes if you're lucky, you'll get a please. So what happens when we go crazy, information crazy in a crisis? Well, we get progressively worse at producing and processing information. So my team and I asked this crisis, what can we do differently? So after we considered going into hiding, as we saw the oncoming storm of information requests, we did a big intake of breath and said, let's focus upon how we can change the experiences and perceptions of our customers, our suppliers, our partners, and my own team as well. So what did we do? Well, the first thing we did in terms of principle is we centralized. So we created very quickly a single hub, web-based, of all of our COVID-related information. We built a lot of web forms for data collection, because there's been a lot of new data collection in the organisation that we didn't have organisational systems for. And we created a single database for storing, processing and reporting all data. What did we achieve with all of this? Well, quite a few products. So we created 15 plus web forms, which were available for all users to enter into, working across multiple device types. We had this notion of personal areas, so you could monitor your own assessments and do reassessments. There was workflow built into that, so people would receive automated emails about notifications that they've had something pending to do. And we kept the history of absolutely everything, so we could plot BI reports to show the progression of the improvement, the worsening of things. 25 BI dashboards, going all the way from service to trust level summaries. Very detailed service level reports. So these were detailed assessments. Can't really see it on the slide that I'm presenting, but there was some kind of the last 5 assessments to track progress. We built user comments, so people could centrally document their views, their opinions, progress, actions. And this was all role-based permissions, so people could share assessments for commenting, reading, editing, sharing. And as I'm sure most of you have had to do, lots and lots of national returns. We do daily national returns. My team heavily involved in that. And had we not centralised this information, responding to those returns would have been very difficult and challenging. So what did all of this cover? Well, obviously our staff weren't immune to infections, so we had a place to log infections, stock control, reporting low PPE, protective equipment, situational reports to describe where buildings have been affected by the outbreak, risk assessments, so that would be work-based risk assessments, to cover everything from, are you set up right working from home? Is your working environment, if you're still out treating patients, safe? Staff redeployments, lots of our staff have been redeployed into frontline roles. Even corporate staff have moved into bed management roles to help move the flow of patients along. And that was kind of in the outbreak phase. The recovery phase was focused very much on how recovery ready are we in terms of getting back to normal, and that's the phase that we're in now. COVID secure, which is another national return, that is around having COVID safe environments for patients, staff, suppliers. Staff swabbing, so we undertake a large program of staff swabbing across the organisation. And now the dust is beginning to settle. We're getting more and more requests for research data to respond to some questions that have been asked by universities. In terms of engagement, so we've had, from the beginning of, say, March, we've had 15,000 web form submissions, which is roughly about 300,000 items of data. 50,000 visits to the BI dashboards. And we set up a system of automated emails. So about 9,000 of those have gone out to people. In terms of savings, although it wasn't obviously orientated towards savings, but I've estimated around 200k of my information team's time, which is roughly about 20%. Thousands and thousands of hours within the organisation, not having to send emails, not having to chase down information. So the question is then, why was it different this time? How did we achieve this? We start with the right technology, and it kind of fits nicely within that poll as to, is it being seen as vital now? Absolutely. So we've had, more recently than not, scalable virtual infrastructure. This is infrastructure that my team manage and control, meaning that we could spin up solutions very, very quickly. We've got latest versions of software, which again in the NHS is sometimes not easy to achieve. Very code-like development tools, meaning that we spend less time developing and more time deploying solutions out to people. The right people, none of this would have happened without somebody at the very top making it happen, telling people that we need to work in this way. And that happened to be my boss. I'm very lucky to have a very multidisciplinary team. So we have developers, BI managers, project managers, all of which have been employed to help roll this out. And then the right technology partners, we are an NHS organisation, we're not a technology organisation. So we've had, some of them are listed here. But we look for partners who are responsive, industry leading, and very community focused, because we want to be able to build things and share them so people don't have to go through the same development cycle that we've had to. And how about our customers? Well, they're not quite as angry anymore. Do they love us now? Well, not quite, but they are grateful that we took one more thing for them to worry about away, so we can get into allowing them to get on with their job of looking after us all. So I'll end this presentation by saying the same thing to them as I'll say to you all now. Thank you, and stay safe.
Thank you, Stephen. That's great. I'm really interested in the 200,000 savings, just quickly ahead of the panel, because I'm sure someone's going to ask about that. How did that, did you use that to redeploy into other things?
So some of our staff have been redeployed into patient-facing roles, bed management. Some of them have been obviously redeployed into other areas of data collection during the crisis. So it's an estimation based on the, let's say, Q1 costs and the portion of my team not doing normal duties. Yeah. I think what it's shown is that if we put the right platforms in, we can work much more efficiently with far less people hand cranking things.